Hello, and welcome to Hospice Insights, the Law and Beyond, where we connect you to what matters in the ever-changing world of hospice and palliative care. On the road with your hospice team, a report from Home Care 100. Emily, Bryan, we had an exciting trip to Orlando, and I can't wait to talk all about it.
It was wonderful. I was glad that we went down, and it was a lot of fun seeing a lot of familiar faces. So happy. I'm excited to talk about it as well.
So I think for folks listening who haven't been to the conference before, it's very interesting because there's a lot of home health folks. I mean, there's also hospice folks there, but a lot of home health folks. And I think this conference, more than many conferences, is very future looking. And I think it's future looking for all of the attendees, but the fact that there is a lot of home health providers, I think naturally it's future looking because we're sort of behind home health and some of the changes in terms of carve-in to Medicare Advantage and other things. So there's, I think, a lot to take in for hospices about reading the tea leaves about what our future might look like. And I think too, what struck me is maybe this is my first takeaway, is that we are getting beyond these silos, right? The lines between home health, hospice, palliative care, primary care is just blurring. And it's really now about healthcare in the home and bringing it to people in the home. And, the specific provider type, maybe you have people doing lots of different things and their title, like I'm a hospice, I'm home health, maybe that doesn't matter so much for the future. But I don't know what your thoughts were about that.
Yeah, I agree, Meg. And when we went to this conference, it's a really good crowd there. A lot of leadership from these home health agencies and hospices, a lot of innovation. And it's exciting to see kind of the top thinkers in the area try to figure out a way to make sure their businesses can operate and continue to serve these patients, but employ technology as a way to expand what they're offering and serve even more patients and serve them better. And what you were saying, Meg, about the lines blurring, I was at a number of home health presentations where they were talking about technology and how can we communicate among caregivers. And they were talking about it in the home health context, but I saw there's applicability here for hospices as well. I mean, these are not going to be areas of technology that are limited to a single provider type, but it's areas that even hospices can take advantage of to try to improve how they deliver services to their patients.
And I think that the technology, not just in the telehealth format of it, but technology in terms of how do you manage staffing shortages, right? How do we overcome this hurdle? I mean, I think the two repeated phrases were value-based care and staffing shortages, and trying to solve for those, challenges. And I agree, Bryan, technology can be utilized both telehealth, but also how you deploy staff. And I know a lot of clients now are starting to use technology about tracking staff, and if someone needs something, getting that person routed who's nearest there, and just thinking about it different instead of, and I did a podcast with Michael McHale when he was at True, where we talked about that. They have a PACE program, and it's like, not doing visits maybe Monday, Wednesday, but doing it when people need it. And then how do you deploy resources if it's sort of when I need things?
Yeah, and it's triaging as well. I mean, that's one of the presentations talked about having the nurse on call, and they developed a way to make sure that's good for both the provider and the patient. The patient has a faster, more direct track to a clinician if that is what they need, but it really sorts out calls based upon clinical need versus calls that can be handled in other ways. And there's an app or a kind of software that's designed to make efficient use of staff, but also deliver more customized care to the patient. So very interesting stuff.
Did you have something to add, Emily?
Yeah, one of the things that I was interested in hearing about was a platform that one in-home health company was using to build their culture. Because when you have staff that don't all come to the same place to work, it's hard to build a good culture within there, and that can affect your staff retention. And so that would apply to hospices too, is that getting these platforms that can help you communicate amongst employees and help build that culture. I thought that was a really interesting platform too.
I think technology a theme, staffing shortages theme. I think the largest was value-based care and risk-based contracting. And something that struck me, one of the presenters said, in the future, the profit of the organization is all going to be what you get from your risk-based contracts. And that's a real holy cats. That is a very different model in terms of thinking about our business, right? And how do you enter into managed care relationships and not lose your shirt, right? And I think there's a lot of stories of taking baby steps, and also people saying, this relationship doesn't make sense for me from a business standpoint anymore, and when to sort of walk away from certain payer relationships. But I think also realizing that it's going to be performance based in the future, and that how do you align with that, because they're going to continue to press on rates, and the upside is going to be through outcome and metrics that align with managed care, Medicare Advantage, their metrics, right? Like, how are they measured? And then that flows down, and how are you helping them, meet their goals? And so I'm sure that makes our listeners nervous and a bit queasy, but again, I thought a great conference to learn how other people are managing that.
Yeah, and there's a lot of, I mean, this is a conference of both providers, but also those who want to support providers with ideas and platforms and technology and innovation, not just technologically, but in thought about that. And so there are those folks out there who are generating these ideas outside of just them being homegrown within providers that you can look for and seek out. And again, we saw a lot of that in the home health area, but they're going to be coming to hospices as well to help generate these ideas and implement them. And as you said, Meg, a lot of it, the benefit is going to be on sharing risk. So when these people come around and have new ideas, who's going to take the risk of the new idea? And that's going to be, a significant part of a negotiation between these vendors and hospices, or the Medicare Advantage contractors and hospices. Who's going to shoulder the risk and have the potential to make their business grow even more so? And if you don't take the risk, I think you're more likely to kind of flounder in the way the economics of this will work out in the future.
Yeah, I'm thinking to the presentation that said, and it was focused more on a primary care practice, but if you just do fee for service, this is how much the practice is going to make. And then this is how much you're going to make if you take some risk. And then if you take more risk, and, because we're all finite humans, right? We only have so much time to work. And how do you, grow with the same resources you have? And so, yeah, that was really interesting. And I think internally, that's why we've been building our payer contracting resources and the expertise we have on managed care contracting, because it is going to be the future for us too. Emily, you made a really keen observation, and something that resonated with you about the whole MedPAC and how they report profits. And why don't you share some of that? Because I thought that was a really interesting point.
Yeah, so a lot of the conference was future looking in the long term, but one of the short term things that really stuck with me was the way that that Congress looks at the profit margins of home health agencies and hospices, and that's of course given to them through the agency called the Medicare Payment Advisory Commission. It's a nonpartisan government agency that collects data to share with Congress as it makes decisions about funding. And my understanding of the presentation at Home Care 100 was that it was difficult to challenge a potential rate cut for home health and hospice providers because a MedPAC report had shown a profit margin of around 25%. But how they were getting to that profit margin was a questionable way of doing it, because they were lumping in not just home health and hospices, but I believe they were also including the Medicare Advantage side of things as well. And it really skewed what that profit margin is. And that's especially true for hospices. And so working to try to dispel MedPAC of evaluating profit margin as that way is a short-term goal, I think, of all providers.
Absolutely. And I think that all the more reason why we need to be more connected on this and have a unified voice, because there's, this doesn't impact one provider. I mean, it's impacting an entire industry, and, there's going to continue to be push on, rates, even when we're carved into Medicare Advantage, assuming that happens, there's still going to be fee for service, at least in the foreseeable future. And so, I think that obviously hospice didn't have the proposed rate cut that home health did, but reading the tea leaves, what happens to others before us is likely going to be happening to us, because there's been a similar drumbeat of profit margins on hospice. So yeah, I think that was really interesting as well. I guess as we close up here, any other observations, things that were fun?
Well, Meg, one of the best presentations, of course, was the panel that you led at Home Care 100.
Thank you,
with
Bryan.
some heavy hitters in the hospice community. So talking about the Medicare carve-in and how that is approaching, and how some of the leaders in that area are thinking about that and preparing for it. I think by this point, everybody needs to be ready and thinking about how their business is going to change based on that. And given how hospices have operated over the years, we have the per diem payments, we have the hospice aggregate cap. Going to Medicare Advantage is certainly going to be different and a transition from all that. But we're kind of learning from home health agencies about how they are going through that, which I think can make that transition for hospices, once it comes, a little easier, and kind of learn from their mistakes, learn from their successes, and take advantage of that.
Yeah, I tried to be bright-sided in that panel, because there's, I think, a lot of heartburn that Medicare Advantage causes all of us, big and small providers. And I think that there was good discussion around what are the opportunities, not just there's change and I don't like change. It was a fun conference to be at, and a lot of food for thought. And so thanks for joining me in Orlando, and now we're back in the winter up here in Wisconsin. So that was a nice reprieve for many reasons, being in the sunshine again. Well, that's it for today's episode of Hospice Insights, The Law and Beyond. Thank you for joining the conversation. To subscribe to our podcast, visit our website at hushblackwell.com or sign up wherever you get your podcasts. Until next time, may the wind be at your back.